What is up, you guys, and welcome back to Elevate Fitness. For those of you new to the channel, you might be wondering why I've got my scrubs on. I'm a nurse. I've been a nurse since 2004. Today's video, we're going to get a little bit more serious, bring things down a little bit. We are going to talk about why I do what I do and the reasons behind Elevate Fitness. Stick with us. High blood pressure, high cholesterol, type 2 diabetes, obesity, anxiety, depression, dementia, all terms we've probably heard, but not super familiar with, not all of us anyways. You guys, we're facing an epidemic, and I am not talking about COVID. Chances are, if you're watching this video, you've been diagnosed with one of these diseases, or you know someone that's been diagnosed with one of these diseases. Chances are also that if you've gone to see your medical provider in the last little bit, they may have spent 15 minutes with you to discuss this disease, and you probably left with a prescription in the form of a pill. Most MD visits last 15 minutes or less, and while there may have been some discussion about diet and exercise, there is no world that exists in which 15 minutes of education is going to stick, especially if the doctor just told you that you have type 2 diabetes, and now you have to take a medication twice a day for the rest of your life, and they also told you about all the side effects that come with diabetes. While I can guarantee that the majority of doctors have the best intentions and truly want to help people, the way the system is set up does not give them the time they really need to educate patients about chronic disease. It might be absolutely necessary for that doctor to prescribe that medication to prevent immediate complications. It may not be necessary to take that medication long term if you're willing to make some lifestyle changes. How can we expect our healthcare practitioner to provide the education necessary on chronic disease in 15 minutes? We can't. It's an impossibility. It's absolutely impossible. So in an effort to prevent further complications, they give us a Band-Aid, and that Band-Aid usually comes in the form of a pill. Don't get me wrong, Band-Aids are beneficial and useful, but when's the last time you used a Band-Aid long term? Band-Aids are used to treat something for a couple of days and then they're gone. We don't take a Band-Aid off and on 2 to 3 times a day for the rest of our life. Our bodies are designed to maintain an optimal status. That status is known as homeostasis. That's why when you get a cut, that Band-Aid's only needed temporarily, because our body has a process by which it helps to heal itself. The same is true for many chronic diseases, but the vast majority of us are unaware of the steps we can take to help the body in this process, or even worse, we put things in our body that compound the problem. We have not been given the tools and resources we need because our healthcare system doesn't have the time to provide the patients with all those educational tools. As a result, healthcare is no longer healthcare. So what is it? It's sick care. The majority of healthcare providers don't have the time they need to teach this educational material, so they resort to treating the sickness instead. It's sick care, it's not healthcare. I've been in healthcare since 1999 and a nurse since 2004. In those 24 years of healthcare, I can count on one hand the amount of times I've had to provide education or had the time to provide education to the patients necessary to maintain that healthy lifestyle. As a result, I'm left with the words of the practitioner and the orders of a practitioner treating the sickness and treating the symptoms associated with that sickness, not educating people on how to maintain a healthy lifestyle. This has always bothered me, and after many years of helping to treat and manage symptoms from preventable chronic disease and watching people die from things that were preventable, I decided that I needed to make a change. I had some of the tools, knowledge, and resources to provide to people to live a sustainable, healthy life, but not all of them. I needed more education. I needed to educate myself on some of those things that I didn't know about, so I enrolled and got my CPT, and I'm working on my CNC. My passion has and always will be healthcare, and in order to continue to provide healthcare versus sick care, I had to make that change. I needed to make some changes, so I made them. I also wanted a platform where I could reach as many people as possible and provide them with the tools, education, and resources they needed to live a functional, happy, healthy life. That's why we started Elevate Fitness. The goal of Elevate Fitness is to help as many people as they can elevate their life. Life is meant to be enjoyed. Next video series coming, you guys, is going to be about what you need to do to get there. Chances are, if you're watching this video, you're not sure what steps you need to take to start living a healthy lifestyle. We're going to talk about how to plan, how to set goals, how to find accountability, how to find people that you can relate to that are going to support you through this journey. So stick with us for the next video, you guys. Until then, elevate your life. Peace.